Hello and welcome to the Kent and Medway Medical School's Virtual Open Day. For those interested in 2023 entry, we're here to show you everything you need to know about studying at KMMS from the comfort of your own device. During this event, we'll be chatting to staff at KMMS along with current medical school students to get a taste of what the course has to offer and find out more about life and study across the two campuses. Now, whether you've got questions about the course, student life and well-being, or want to know what our students love about Canterbury and KMMS, do send us your questions via YouTube or Facebook in the live comments section and we'll get those answered for you. If any of you have more personal questions regarding your entry requirements, you can send those in separately to admissions@kmms.ac.uk. As we're all working from different locations, we may encounter some technical glitches, so do bear with us if we need to sort any of those out. Now, let me introduce our first speaker, Deputy Dean and Undergraduate Programme Director, Dr. Anna Romito. Dr. Romito, it's over to you to kick things off.
Thank you. Thank you very much for having me this evening. Thank you very much for your interest in KMMS. So I'm going to be talking to you about what we have, what our offer is at KMMS, and some of the details about how you're going to be learning. And then at that point, I'm going to hand over to our head of year one, who's going to go into a bit more detail about what your first year at KMMS would look like if you were to join us. We have some slides that will accompany my talk, so it'd be great if we can get those up onto the screen, and then we'll start talking about some of the different facilities that we have available. In terms of myself and my background, I'm currently working as a GP. I work in the local area. I work about 15 minutes from where the main campus is in Canterbury. I'm the first doctor in my family, and that might be something that resonates with some of you who are interested in studying medicine, and I full-heartedly recommend it as a career choice. So what we're offering at Kent and Medway is we're offering a Bachelor of Medicine, Bachelor of Science degree, the Bachelor of Surgery degree, and this is jointly awarded by two universities, the University of Kent and Canterbury Christ Church University. As a new medical school, we work in partnership with an existing medical school, and this is Brighton and Sussex Medical School, with whom we have very close dialogue, and we compare and contrast our curriculums, looking at what is working well, what's been successful for them, and how we can use that to enhance the programme at KMMS, and how we can mutually learn from each other. It's also a partnership that has allowed some growth between the student bodies as well. And some of the students later might want to talk a bit more about this. But for example, there's some joint sports tournaments and some peer support models that we're looking between the two schools. Next slide, please. Our vision within the school is that we are a place whereby people who are aspiring to be doctors have this as their place of first choice, where you want to come and learn about person-centered care. We can't be good doctors if we're not thinking about the people that we're looking after here. And this is something that we really emphasize in your program. We want to make sure that you've got all the skills, that you've got the technology, that you've got the knowledge, you've got the interpersonal behaviors and attitudes that mean that you're going to be able to deliver really excellent care in the way that the NHS is changing, and to be able to respond to that. We don't want you to feel that when you go on out and you start working on the wards that you've got any areas of vulnerability. And we know that the NHS is changing quite rapidly. It's responding to things like the pandemic. It's responding to changes in the needs of the population. And we're confident that our course will be able to prepare you for that. Next slide, please. One of the things that we're really keen to do within the school is to help widen participation in medicine, so that individuals who are coming from backgrounds whereby medicine may not necessarily have been a career choice that they considered available to them are able to come and be our students and be our doctors of tomorrow. We also feel that we've got a responsibility to address some of the health inequalities that we have in the region. Kent and Medway is enormous, and there are significant demographic differences in our patient populations and some challenges there within. And one of the things that we want to do is to help address those by inspiring you to want to come and learn and study and then stay in the region where you can then practice, particularly in disciplines like mental health, primary care, or acute specialties. We want to be providing you with high quality placements. So one of the features of our program that you'll see is that we do placements early. We do them from the first term of year one. And we do this so that you can learn in what you're learning on campus, you can then apply in the clinical context. You can see why it's relevant and why it's helpful, and it becomes real and it feels important to you. And we want to inspire you again to learn of the people who are living and working locally as healthcare clinicians. And that's only going to be achieved if we've got high quality placements where you've got good levels of exposure and you feel integrated to the clinical team. I mentioned some of the areas in the region that are particularly looking to increase the numbers of doctors working in those fields. And that's again one of our responsibilities, is to make sure that you have good exposure to these kinds of disciplines so that you can understand what a career in those disciplines might look like. And also, we are a new school. We're in a position whereby we can do things afresh, we can do things new. So it makes sense that one of the things that we want to do is to have an innovative curriculum that can prepare you for the NHS that you're going to be working in and can harness the best of modern technologies and modern approaches to education to have an innovative program for you. Next slide, please. Within the school, we have a series of values that you'll see here listed out on the screen. I'm not going to read them out individually one by one, but we have a number of values that we hold dear to us, and these are ones that we would hope as students that you would also appreciate the value of them, and that you would think that these are good qualities you'd be expecting to see as doctors and as prospective doctors. But it's also something that we hope that you would see in your staff and the people who are around you and the general ethos of the school, because I think with this, we're then going to be able to help deliver upon the vision that I mentioned. Next slide, please. Okay. So when we opened back in 2020, it feels like a long time ago. There's been quite a lot that we've achieved during that time. We've been running the medical school for the last 18 months. We opened in September. This was after the very first lockdown, but as we all know, we've had a series of other lockdowns after this point, and we've continued to deliver a program throughout that time. And that is alongside a number of our staff also being affected either with COVID or having to respond to the increased clinical pressures that COVID has created for the NHS. We have a growing international faculty, and we've got a number of those roles that are in partnership with key stakeholders, so the NHS, the local government, Health Education England, and this allows for some transferability of knowledge and for collaboration with key important partners in the region. We've now started to make some research appointments and getting grants again to support our research endeavours. And as students, you'll be doing your own research projects from year one. You've got research projects in year 1, year 2 and year 4, and year 3 is a planning for your year 4 research project. So research is really important to us within the school, both from your perspective in your programme, but also as the school grows. We raised a significant amount of money to help develop some of the facilities within the school and also the scholarships, again, to try and support you during the course of your studies so that you can come to medical school without the concerns that you might have had about the financial ability to be able to do so. So far, now that we're in year 2, we've been running placements across both years 1 and 2 in primary care networks, which is a PCN acronym that you'll see there. Across the region. So we have 23 primary care networks that we're working with. And in a primary care network, it's often more than a typical GP surgery. So it will include, for example, other local facilities such as pharmacy or response teams, occupational health or physiotherapy and so on. So other kind of disciplines that are provided at a community level. And the reasons we do this is so that your placements when you're out with your GP supervisors in primary care is actually learning already about the wider team that are helping to look after our local patients. And within the student society, we've got, the student body, we've got medical societies that are being formed. So we've got MedSoc, which has got academic representation as well as social activities. And I know that you'll hear more about this later on. And then sub-societies where people have identified particular careers or disciplines that they're interested in. And our students have already started to be active in that space, which is amazing. And some of the things that they are doing and organising, I think they quite rightly are proud of. And we're very proud that they are our students. Next slide, please. I'm going to talk to you now about some of our facilities. So I mentioned that we have a main site for our campus learning, which is based in Canterbury, but this is split over more than one physical site. So between our two partner universities, University of Kent and Canterbury Christchurch University, we have a couple of key buildings, as well as some of your learning might take place in spaces and facilities that are shared with other students, not just medical students. Particular point to emphasise is a new building at Verena. It's called the Verena Holmes Building at Canterbury Christchurch University, which is in the centre of the town. This hosts an anatomy learning centre where there's cadaveric dissection, anatomical models that you can learn from, and where you learn about both gross anatomy, so structural anatomy, as well as radiological anatomy, so using images to help you learn. And I say this not just because I'm a GP, but because only some of you are going to go on and undertake surgical careers, whereas those of you who are practicing in other disciplines, you may not necessarily see the inside of bodies so much, but you need to understand how they work. And you'll certainly be looking and relying upon pictures, X-rays, CTs, MRIs, ultrasound, to understand what the issue is with your patients and how you're best going to respond to it. So again, we think it's important that you learn about how you would appreciate anatomy in a clinical setting, other than the sort of gross anatomy that you'll see. Also within this building, we've got high fidelity simulation suites. So we've got different areas, for example, like small hospital wards or larger hospital wards that are fully equipped to be a functioning ward. And these are spaces that we share with other healthcare students. So you have nursing students who are learning and working in there, along with other programs that are delivered at Canterbury Christchurch University, as well as yourselves. And it allows you to learn and to practice your skills in a safe environment so that you then feel confident and comfortable, and moreover, you're safe before you then have an opportunity to go out and practice these when you're on your placement settings. The next slide, please. We're going to continue talking about some of the facilities. So I mentioned about the University of Kent. So there is a campus for the University of Kent where we have, again, a brand new building, which is called the Pears Building, named after one of our benefactors. And this is where we have offices, seminar rooms, lecture theatre spaces, as well as a simulation suite for primary care, which is kind of clinic-based rooms. And you'll see a small picture in the bottom of the slide here of the inside of that space. So it's set up as you would expect in a general practice consultation room, with an examination couch and the equipment that you would see in that context. And within that space, we have cameras which can be used for learning, so you can look and learn back, watch yourselves or watch your peers, or watch videos of consultation styles, and use that to reflect upon your skills as you develop them. Next slide, please. So in terms of what you're going to be learning at the program, so just to sort of lay it out clearly, that in terms of what we do here, whilst we are innovative, we are going to be sticking to the core things that you have to learn. So we have stakeholders, for example, the General Medical Council, who have a very clear influence over what is important for you to learn in order for your course to be recognised and for you to graduate as a doctor. So there are some key documents from the General Medical Council. One is Outcomes for Graduates, and also there is further information from the General Medical Council about the medical licensing assessment that you do in your last year. And these are really important for us, and we benchmark our programme to this. There are, in terms of how the GMC organise the learning, you've got professional values and behaviours. I'm not sure how clearly you can see on the slide, but there are a number of different sections there within. For example, your professional responsibilities, legal responsibilities, patient safety, and so on. You also have professional skills, so your ability to communicate, your ability to diagnose or to prescribe. And then you also have professional knowledge, so understanding about the healthcare structure, understanding biomedical principles, social science principles, all the different things that you're going to need. And our program from the get-go is looking to map what we are teaching you to this. We have 5 years for you to learn everything that you need to learn here, but there may be times where that doesn't feel like that's quite long enough. So we have in the program what we consider core, what we consider to be really important, using documents like this to help steer that. And I think that also gives you confidence that we are teaching you things deliberately, purposefully, with an end goal, that you're going to get to the point of completing this by the time that you graduate, and that you're going to be able to perform well in that medical licensing assessment, which is a standardized assessment that all medical schools have to do and all medical students have to do in their final year. The other thing that we also are standardised against is our Brighton and Sussex Medical School. So I mentioned before that we are paired with them, and this means that we look at what is being taught in each of their years and we make sure that our curriculum is keeping pace, although we may choose to deliver certain modules in a different way according to what we think are the points of emphasis that you're going to need for your particular programme in the local context in which you're working. If we can go on to the next slide, please. So the program is divided up into a number of kind of key areas here to try and achieve what I've been talking about in the last slide. And we refer to these as fundamental tracks. They're not taught in single events. They're not taught in single modules. You'll see them interwoven across a number of different modules across a number of different years. And that's deliberate. It's done so that you've got those building blocks that progressively you're going to be able to work on what you learned before, then apply it, take it further, and so on. But the key areas to know are that we cover anatomy, biomedicine, physiology, pathology, and so on, the things that you can see on this slide here. So that overall, you're going to have a full well-rounded curriculum. But that is also joined up. So I mentioned about layering things on so that we know and we're clear where is anatomy going to be taught, and thinking about making sure that you're getting it at the stages that are going to be most helpful. So as example, your anatomy is something that you'll learn quite significantly in years 1 and 2 in the dissection suite in the Anatomy Learning Centre alongside lectures and self-directed learning, textbooks and so on. And then your understanding of anatomy is going to continue in, for example, years 3, 4 and 5, but it's going to continue in the clinical context as opposed to the campus context. But it's deliberate and it's thought through about what it is that's going to prepare you for the next stage, and that applies to all of these different disciplines. I mentioned before about the fact that we use the time on your program to help teach you what is core. That's the most important thing we're doing here. But we also recognize that some of you are going to be particularly inspired for different branches of medicine. You're going to want to pursue different routes and avenues in your careers going forwards, and find different bits interesting. So we do build in choice elements here. I mentioned that you do research projects in years 1 and 2. These are within what's called selected student components, so you can see that on the slide here. So you get to choose a topic, and we give a sort of pre-prescribed list that you can choose from. We give a number of different options that you can select to then be able to do some project work on that. So you take your ideas deeper. And the same is true with the research project in year 4. And for those of you who are keen to go really deep down, then you can do what's called an interconnected degree, where you intermit from the program. You take a year, sometimes longer, out to undertake a different degree before resuming your medical studies, which allows you to go obviously into that level of depth. Next slide, please. What the next slide is going to show you is an overview of our curriculum structure. So you might have seen this already on our website. This describes across the 5 years what our different modules are. And you can see the different arrows going across and going down. These are trying to sort of replicate what I've been saying about building upon your learning. So when it's horizontal, we look at how some of your modules continue for the whole year. So a module called Community and Primary Care and Practice, as example, is one that you do across the whole year here. What that looks like is that the modules that you can see in the bottom in chunks for year 1, so for example, Foundations of Health and Disease, Heart, Blood, Nutrition, Metabolism and Excretion, that you, whilst you're doing those modules, you will have brief dip-ins from those other modules like Community and Primary Care and Practice, where you'll spend a bit of time doing those long modules at the same time as doing the Foundations of Health and Disease module. I'll give you a specific example of that, but I know that Dr. Oliveira is going to be spending more time on this. You might be learning, for example, about the cardiovascular system in heart, lung and blood. You then have a placement week under the Community and Primary Care module, where you'd be learning about patients who've experienced cardiovascular health problems. That's an example of what we mean about horizontal integration. And then in terms of the vertical integration, that's the arrow down. So what you learn in year 1, you build on in year 2, you take to year 3, and on it goes. You'll see that our years 1 and 2 are quite similar. They both have 3 modules that span the year and 3 modules that you do for a term each before moving on to the next subject. And in that way, we've covered the main body systems that you've learned from a knowledge point of view, and concurrently you've been learning about the relevant skills for those different disciplines and body systems. You've been learning about how you might examine and identify some key signs and symptoms for those kind of pathologies. and also what this might mean in terms of ethics, law, morality, or practice, what development needs you might have when you're coming across these issues. From year 3, the amount of placement time that you have becomes significantly larger, and you'll spend the majority of years 3, 4, and 5 in clinical placements on trust sites across the region. We've got a number of acute trusts that you'll be allocated to, and you would reasonably expect that you'll be in a different one in between years 3, 4, and 5 as the norm. And that way, we feel that you're going to get good exposure to a range of different medical specialties, but you're also going to get exposure here to different patient demographics and different organizational structures and arrangements as well, so that then when you graduate, you're going to feel confident and you're going to feel fluent in working in different environments that you haven't been in before, and that you feel that you've had that good breadth so that you can be flexible according with then what your postgraduate training looks like. So this is just a quick whistle-stop tour of your program and of some of the facilities and the infrastructure that we have, and some of the ethos and the vision that we intend for your learning here. And at this point, I'd like to hand over to my colleague, Dr. Oliveira, who will go into that more detail so you can understand what this would look like in practice in year 1 and beyond. Thank you.
Dr. Romito, thank you very much for joining us. That was Deputy Dean and Undergraduate Programme Director at the Kent and Medway Medical School, Dr. Anna Romito, kicking off our KMMS Virtual Open Day. Checking in on our streams, I can see we've got viewers from Rutland, London, Rochester and Oxford. Thank you all very much for joining us, and I hope you're discovering plenty about the school. And do send in any questions that you might have. We'll get those answered for you in the next couple of hours. Now, as Dr. Romito said, we'll be back very shortly hearing from Dr. Anna Oliveira, who is the head of Sorry, I've lost my notes there, but head of the Medical Biosciences. Thank you very much for bearing with there. Like I said, we might have a few tech gremlins. We've had our first there. We'll be back in just a few moments' time, but first, a few introductory videos to the Kent and Medway Medical School.
I chose to study at KMMS because it's unique, we get early clinical exposure, the course is integrated, which means whatever we get taught at university, we can apply on placement, which helps consolidate our learning, and it means we can meet the patients early.
With my previous degree, there were lots of cohorts, but the university has very limited number of students, which I felt there's got to be a more bond with the staff, lecturers, and with the cohort. Then that really attracted me getting into the course.
I'm from Canterbury originally. I grew up here, so I'm just super proud to be a part of a medical school that's going to help my county. Yeah, and it's fantastic facilities as well, so what's not to like?
I had my heart set on medicine for ages, and I always kind of had an idea that I wasn't necessarily good enough to get in. I think that though it was quite inaccessible to people like me. I come from a widening participation postcode, and so when I found KMMS, I just really felt like I'd found a kind of place that would be really accepting of people from maybe different backgrounds, and I felt that they were genuinely making the effort and taking the steps to improve participation in medicine, which I think is just so key if we're going to have doctors for the future that are able to relate to so many different people.
I chose KMMS because it's my local university. I previously worked at Medway Hospital, so I thought the two and two worked really well together, and it meant that I could study while also continuing my work if I needed to as well.
I chose KMMS because I believed it was a place which would help me develop into the doctor I'd like to be.
We're now joined by Dr. Anna Oliveira, who's the head of medical biosciences and lead for year one at KMMS. She's joining us with two KMMS year one students, Jessica and Saskia, who we'll be talking to in just a few moments' time. If you have any questions for Dr. Oliveira or the students about studying at KMMS, please remember to send them in via YouTube and Facebook so we can get them answered for you. Now, that's enough from me. Dr. Oliveira, it's over to you.
Thank you very much. Hello everyone, my name is Anna Oliveira. I'm the head of medical biosciences and year one lead for KMMS. I am a pharmacist by background, but I have a great passion for medical education and been in medical education for quite some years. And it's absolutely lovely to be part of KMMS, and I hope to be welcoming you very soon. What we're going to talk here with me, I know you've been with Dr. Romito, and I talk a little bit about what would you learn at KMMS and the curriculum structure. I'm more focused in year one, and year two is a mirror of year one, as you've seen probably in that diagram that Dr. Romito has shown to you. So you've talked about what you will learn, all the modules, those fundamental tracks, but how will you learn if you get to KMMS? We're very proud to have a variety of pedagogy techniques that we have at KMMS, and very proud because every student learns in a different individualized way, and some methods work better than others, and also because depending on disciplines, some methods do work better than others. If we're talking about learning and teaching about ethics and medical humanities, compare when we talk about biosciences, for instance, your anatomy, etc., you need different methods, and we kind of use a lot of different methods in KMMS. What is really important is exactly what you see right at the center of the slide. We have a lot of pedagogy techniques here, pedagogies that have you in the center. And you can see some of them there in the slide, not as an exhaustive list, but you can see the most important ones there in the slide. And the fact that you are at the center does mean that it's quite an applied type of learning. It's collaborative, it's independent. You are at times almost asked, but you have that capacity of learning on your own pace when needed, but also independent and self-directed. So you have different types of learning that will happen. And looking at the slide you have there, you have, for instance, team-based learning. That's a method of teaching we use quite a lot in year one and year two throughout Foundations of Health and Disease and the system-based modules that you've seen Dr. Romito mention, like, for instance, heart, lungs, and blood in year one, and nutrition, metabolism, and excretion. And it helps you to check your understanding of the bioscience you've learned and then apply that into a clinical scenario. And it's been really successful, and I know the feedback from students is really good, and really helps you understand, apply knowledge, and work as a group. You use also a case-based learning, especially during the placement weeks, where you also have a clinical scenario, real-life scenario, where you can discuss with your group. Interprofessional learning, our year ones, this term had some meetings with pharmacy students from the University of Kent. For instance, an example of what happened immediately in year one. We use quite a lot of flipped classroom. Team-based learning is an example of that, where we ask you to do some work before joining us. We flipped the classroom, so you work a little bit before. Either is that doing an e-module, listening to a lecture, and then you come to the session to do some work. We strongly have a strategy of having a blended digital and face-to-face learning. And by digital, we might mean asynchronous learning, for instance, an e-module or that we give you and ask you for you to complete before coming, or online lectures that can be delivered synchronously, for instance. But there's a big component of face-to-face in our teaching that we find is very important and needed, especially when we talk about group learning. And peer-assisted learning, that is massively important. For instance, that's part of the curriculum, but the fact that you learn with your peers is incredibly important, even for you to practice your clinical skills right from year one. Of course, this is all complemented with other methods of learning, like, for instance, large group lectures. Yes, lectures are there to give you the main concepts, but then you can go to the small group learning and apply and consolidate. Your anatomy is usually one of the favorites, and anatomy is taught mainly by dissection besides lectures, and that is done in the facilities that Dr. Romito already showed to you. We also do very small group tutorials in groups of 9 to 12 students. For instance, your ethics tutorials are done this way. Simulation, you've also seen all those facilities for instance, for your clinical skills. E-modules I mentioned. The placements were also mentioned by Dr. Romito in year one and year two. Those are primary care placements. I'll have a slide later on to talk about that very briefly. And as I mentioned, there are moments of self-directed where you will have some teaching to do, and there are moments that you have time in your timetable to do so. Next slide, please. Now, this slide represents an example of a typical timetable. So we've been talking about how will you learn, and it's all nice. We told you the modules, the type of teaching, but how exactly does this look? What type? And I think it's usually quite a very frequent question you have, and it's quite a fair question. And this is how a potential couple of weeks, you have 3 weeks here, can look for one individualized student. Now, the different colors you've seen here, and I apologize if this comes in your screen really, really small, the letters, don't worry. The different colors you see here are different modules of year one. If you remember that colorful diagram that Dr. Romito showed you, we have several modules of year one running alongside each other. And so they represent, for instance, the green one is the professional development and person-centered practice module. The blue is the foundations of health disease, which is a bit smaller, ends at the end of term one. In yellow, we have the community and primary care in practice. And in this yellow-orange, depending, we'll have the skills for clinical practice one. Now, what can we take from here? Several things important. It is a full-time course. It is a 9 to 5 timetable with usually a protected time 1 to 2 for lunch, with some exceptions. There's very rare exceptions where students might have to finish after 5 or have something at lunchtime. In general, we try to protect this to this time. And you always, also in general, with very, very rare exceptions, you have your Wednesday afternoons free without any teaching allocated. And you can use that time, for your own well-being activities if you want, your own study if you want, of course, but it's also a time that usually the universities have a lot of activities planned, the societies, etc. So it's a time for yourself, really. Now, there's a couple of other things that you can see here. One is those blank times, which are blank, but it helps you organize yourself to either have a break if you're in between a lot of lectures, or to do some self-directed teaching. Sometimes we do protect that. For instance, if you look more on the right side of the slide, you'll see a gray area that says online mandatory training. That is protected time for you to do mandatory training you have to do before your first placement. Other times we might not put anything in your timetable protected, but we give you that time for you to organize yourself and do your study and self-directed learning. As a last thing that I would like to highlight is something related with what Dr. Romito said also in her last slide. That is that you can see probably a lot of colors in only 3 weeks. So at times it might look like you're jumping between modules. And this is because we do the timetable and the schedule of the different modules you have in a way that it makes sense. That when you're learning something in the biosciences, you're then complementing that with the clinical skills that you should learn on that system. And then you're going to apply that in your placements. And for instance, if there is a component of ethics, learn around that, then you learn also in the professional development and person-centered module. I know Dr. Romito gave you an example, but another one, very that comes to my mind, very obvious, especially when you enter in the system-based learning. For instance, heart, lungs, and blood. You learn on the respiratory anatomy and the respiratory physiology. And when you're learning that, as soon as you learn that, you then start learning about respiratory examination. And then you're back on the system-based module to learn about pathologies. And you learn all this, and then you go into placement where the case-based discussion will be around respiratory-related cases, and you'll be able to practice what the clinical skills you've learned regarding respiratory examination, taking history from patients with respiratory conditions. And also, while doing that, you're consolidating knowledge because you start seeing what medications have this patient's been prescribed. Oh, what was the mode of action I was taught, etc., etc. So it might seem like you're jumping, but believe me, it's a matrix that will make sense because you're always integrating knowledge and you're always applying knowledge. So I hope that makes sense. Lastly, before we move on, one important thing that I know you were shown the different facilities. In general, we try to keep you in only one campus per day, with very rare exceptions. If you are in one campus for the first lecture, you should stay there always for the rest of the day to avoid that you're wasting time in commuting. I hope this makes sense, but if you have any questions, we can talk a bit later on. Could I have the next slide, please? Thank you. Okay, placement. So let's see some examples of really interesting parts of the curriculum and activities our students do that enhance how you learn and how you actually integrate all this knowledge. And one of them, without a doubt, is the placements. The placement starts from year 1. At the moment, we have immersion weeks, and they are primary care. And I know you've been told already, although, yes, you will observe your GP, the GP practice, but you learn about the wider community care, and you get to see and understand the different responsibilities of a multidisciplinary team and different disciplines, which I think is really interesting, and I know our students really value the time they are in placement and the learning that they can have there. From year 3, you'll then start your longitudinal placements in hospital trust. The images you see here are our students. In this case, there are year 2 students that were based in Medway, visiting an occupational health unit in Medway Meriton Hospital. Another part of our curriculum that was mentioned already, and start from year 1, and you have it in year 1 and year 2, are the student-selected components. So these are part of the professional development and person-centered practice module, both in year 1 and year 2, and they're a series of weeks that you always have a morning for the student-selected components. This, you are given really a broad range of options that you can choose from and do one in each year. And it's supposed to really talk to your main interest. Some of them are quite linked to the curriculum, but take it to the extra step that is your special interest. Some can be really topics that are not covered in the curriculum. We had you see some example on the slide, but we also had some SSCs related how music influenced study, for instance. So there are really interesting topics that you can choose from. I'm sure if you want to know a bit more, our students are happy to then share. But you see some examples, some really important examples. Another very interesting activity you can get involved, and this is mainly outside the core curriculum, it's the research. There are plenty of opportunities for our students to get involved in research, and with time that the school grows, more opportunities come up. We have a lot of expertise within our team, especially in psychiatry, medical anthropology, and public health. And it's really interesting to see that our students, although we only have year 1, year and year 2 for now, they are already being quite involved and having some really nice results of the research they're getting involved. Could we get the next slide, please? Thank you. And finally, one thing that we're quite proud is the collaborations we've been doing that I'm sure enhance the learning of our students. We have introduced a program of collaborations with other schools, both at Kent and Christchurch universities, but also with local charities. You have some examples here in this photo slides. For instance, the photo on the bottom you see here, that's a work that we've done with the Royal National Institute of Blind People. And it really helped. They came to the building and helped our students understand the communication and access needs of patients with visual impairment. We're planning a similar session with students that working with patient educators with learning disabilities, for instance. It's really helped you understand your patient and how to work with your patients. The photo above was actually very recently, a couple of weeks ago, and our students were invited to attend a mock coroner's court with Kent Law students. And finally, here I end more or less what you will learn and how we'll learn our curriculums from year 1. But as any curriculum, we do have an assessment, and that's what I'm going to speak in the next slide. If you could have, thank you. So the next slide, this slide refers to our assessment. As we have a broad range of ways of teaching you and learning, we also have broad ways of assessment, which prepares you and develops skills that you will need as a doctor to ensure you have your knowledge, but also, for instance, skills very important in terms of your e-portfolio. That is something that you'll have to keep for the rest of your career. So if you look on the slide, there's some big examples of assessment that you will experience since year 1. Your applied knowledge test. This is basically assessments that test your basic knowledge. For instance, your biosciences uses usually questions of single best answer or very short answer questions. We have presentations, which is great because it enhances your oral communication skills. We have the clinical skills assessments, which are the OSCEs, which are objective structured clinical examinations and help us assess your clinical skills that you've learned throughout the year. We have essays also. It's a very small number compared with other type of essays, but at least once a year. Project reports and the portfolio, which happens for every module in year 1 and year 2. Although assessment can sometimes sound daunting for you, the fact is it's very necessary, and also we do provide you with a lot of formative assessment opportunities to help prepare you for the summative assessments. So for all the things that I've highlighted, there's always a formative assessment, and you always get feedback, an opportunity to talk with someone and to work on your feedback, and hopefully do better if needed, or do as well as you've done. So there's always formative assessment opportunities. Our assessment strategy was designed to promote excellence and patient safety. In terms of assessments like the applied knowledge tests and the OSCEs, we have a sequential testing of your AKTs. What this means, it means that the students sit the exam, get some feedback, and then later on, in the end of the year, they sit the exam again, and that's when they get an outcome that joins the 2 sets of exams. That's what a sequential AKT is. So we don't have at the moment traditional resits like you may see in other schools, where you have a sit, you fail, and then if you fail, and then if you have a resit where you can then have the final outcome. We've been using the sequential testing in the last since the school started. Obviously, we're very happy with the data achieved, satisfied with the data we had until now. But as everything, we've been undertaking a review of assessments and using our student feedback and their live experience of assessment to see what can be done better or not. But we've been very happy with the data until now. We also, within this, do a fundamental track assessment. If you remember, Dr. Romito showed you a little diagram of fundamental tracks. That's your anatomy, your pharmacology and therapeutics, your physiology, biomedicine, etc. And within your assessment, within your AKTs, we also track how you do to each of these fundamental tracks to ensure you will be a doctor that has an adequate knowledge in all different disciplines that is needed, and that we are preparing you with this for the GMC medical licensing assessment in the final year. And I think that's all from me, and I think we'll have a Q&A now.
Thank you very much, Dr. Oliveira. Really fascinating to take a deeper dive into the curriculum. We've got plenty of questions coming in, so we're going to get stuck right into those, along with current students Jessica and Saskia. Jessica, we're going to come to you first to begin with. Tell us how you came to choose KMMS for study.
Hi, thank you very much. So good afternoon, everyone. So my name is Jessica, I'm a first-year medical student, and I just turned 30, so I've already done a degree, and I worked for several years in various different types of NHS organisations. I've always wanted to do medicine, but with these sort of 5-year courses for us graduates, funding's a little bit different. We obviously have to fund the degree ourselves, so I very much needed to work for quite a long time to save up the money for it. But the passion for wanting to do medicine never went away. But in terms of finding a medical school, I think, it was just really nice that Kent and Medway sort of came along when it did. I grew up in London. I didn't want to be too far away, having done my undergrad in Devon. I wanted to be a little bit closer, and I just wanted to go to medical school, which I felt had some really good core values. And there are various aspects of the course and the things they offer, like cadaveric dissection and other things I could go into, that really drew me to the medical school. But that's sort of my journey into medical school.
It's a really fascinating journey, and really unique, as everyone's journey is to get to medical school, or any degree that is. One of the questions we've had in, Jess, is specifically on that, on kind of your journey as a more mature student. What are the challenges for mature students, and what are what kind of advice would you give to prospective students who are in the same position that you were in?
Yeah, some really good questions. I think one of the biggest things for, us graduates that are a little bit older is it's very much it's a huge life decision. If you are choosing to go in a bit later, is appreciating that this is it's a 5-year course, and then, you've got several years of training. So it's very much, is this something that I'm really willing and wanting to do? Because you can't come into this kind of course without being sure. But I'm a huge advocate for medicine. I love healthcare sciences. I love the NHS. So it was never really anything that was going to put me off doing the course. I feel like I'm on holiday. It's been such a long time since I've studied, and I'm really enjoying being able to just have that as my full-time focus. So if it's something that you want to do and you can't wake up without thinking about it, then it's a no-brainer. It's just, I would say, finding the right med school for you is the key. And for me, Kent and Medway was the right one, so I'm just glad they gave me a place.
Plenty of really good taglines in there, I think, for prospective students, Jessica. Saskia, let's come to you now. Tell us a little bit about your journey to KMMS.
Hi, I'm Saskia. I'm a first year medical student and I am an undergraduate, so I came straight from sixth form. I found that it was really helpful coming from school to then going into quite a structured course, which medicine is very structured. It's from 9 to 5, and I really enjoy coming down to Canterbury. I'm not local to Canterbury at all, but it's really nice city to be in, and I'm so glad to be part of KMMS.
It might be a bit of a generalisation, but I imagine most of you watching will be taking that jump a little bit like Saskia, coming from sixth form or college, looking to go into medical school. For you, Saskia, what was that jump like? Was it really difficult? Did you find it was it took a while to adjust to that different style of study? How did you find it?
I think it can be a jump. The work is obviously very different. So compared to A-levels, I found that med school is a lot of content. And so it's sort of learning to adjust your learning styles. So revision techniques have changed for me. Personally, I use a lot more flashcards or quizzes to try and get through all the content. But I think it is really manageable. You have a lot of support networks as well from your personal academic tutors, lecturers, and I think that's what is really good about Kent and Medway School, is that they do have that support and you can access it, and so that jump, it is really manageable.
Yeah, I think that's a really encouraging thing from doing quite a few of these open days, hearing about that support network there that is on offer to students is a real benefit to coming to KMMS. We're coming to don't want to make it confusing, but we've got a question in from another Saskia on YouTube. This one is for Dr. Oliveira. She's asked, how many hours a week are dedicated to lectures, tutorials, etc.? So, Dr. Oliveira, maybe a little bit more about the curriculum there.
Thank you. It's difficult to say a number of weeks because they change depending on the week. But I would say it tends to be Thursdays is usually a day of lectures. And you tend to have always Fridays and Mondays, days of either workshops, TBLs, examination, history taking, etc. So it depends on the module. With Tuesdays and Wednesday morning, they depending on the week, usually every other week is a Tuesday, a day of lectures, or a day of practicals for the system-based learning, similar to Wednesday, which is more a workshop kind of day, but differs on the module every week.
And just as a follow-up to that as well, is research a compulsory part of the programme?
I think if it's research in a way, doing research is not compulsory in terms of we're going to say, oh, from year one you need to be on a project, etc. But we give you all the skills from year one, so it's part of the academic skills that we help develop on the students, is that they learn what is to be a researcher, a medical researcher. Having all the skills and the power in their hands to understand what is a question of research. How do I go about research? What is good research? What are good papers? What are not good papers? And eventually, when they in first and second year, they get more of the skills, and the fact that they have essays, student-selected components, this help putting some of those skills in place. But in third and fourth year, they do a proposal of a project, and in fourth year, they have to do a project. And ideally, if they would like and work on that, we would love that every single student leaves KMMS with something with a poster, an abstract that is published. That would be lovely, and they will have all the skills to do it. So the project is part of the curriculum. That is part of core curriculum, but it's not compulsory that since year one, students need to be allocated in research. They're two different things, but we give you all the skills needed.
Like you said, a plethora of skills that are given to students, which is great. Lydia has sent in a question. What is a flipped classroom? Dr. Oliveira, maybe you could shine a bit of light on that.
Yeah, a flipped classroom. Yes, it's exactly. So the traditional classroom would be the students go there. They're not required to do any work before, and the lecturer will stand and teach you. And by the end, it might ask you a few questions, or you can go to a workshop after about it. The flipped classroom, it flips the roles, so you switch the roles. So we ask the students to prepare some work before coming to the session. And when you come to the session, then you are questioned about it. For instance, he give you a few questions to see if you understood what you were asked to read. And then we give you some exercise for you to apply what you've read. So you consolidate your learning. You check if you understood. You have staff in place to help you understand if you haven't really understood all concepts, and you then apply them and consolidate them, usually as a group.
And we're going to come back to Jessica now. We've had a question in from Emily. She said, what are the pros and cons of KMMS being a relatively new medical school? I guess what's your kind of experience in that regard been?
That's a good question. I think some of the pros would be that because it is so new, the medical school faculty team are so willing to hear from students. So you're very much a part of the decisions being made. And to students, whether you're coming out of school or you've been working, I think feeling like you're part of a big decision being made is really nice, and it's a nice skill to develop where you are very much part of a decision-making team. And I think the school very much provides that. They are trying things out and they're really wanting to hear whether it works for students, so you're very much kept in the loop. Cons, I think maybe some people like the idea of going to a more traditional school, one that's more established, one that's a bit more known, but honestly it's that doesn't worry me. As long as the school is, accredited by the relevant bodies and they're providing a curriculum where, you cover everything you need to become a good doctor, that's all that mattered to me. But I would say it's more pros than cons for me. But, there are loads of YouTubers out there who also talk about their pros and cons for going to a more traditional versus a new school. But I would say those are the ones that stand out for me.
Yeah, and it sounded really empowering for students and for prospective students, as you said earlier, that they're part of that process. We've got time for just about one more question. There's another one that Emily sent in. This one is for Saskia. Tell us a little bit about the area and the surrounding area of the university. We're going to be talking about student life in the next section of this event, but maybe you just give us a little bit of an introduction into life in Kent.
So the university is based at Canterbury, so we're based at Kent Uni and Canterbury Christ Church, and it's right in the centre of Canterbury. Kent is ever so slightly out, but it's only like a 40-minute walk between campuses, which is actually really nice. The surrounding area has a lot of greenery. We also have beaches, so sometimes we'll go to Whitstable for a swim, even during the winter, which is really nice. There's also it's really lively, so there's loads of restaurants, whatever takes your fancy. There's a lot to do in Kent.
Absolutely. We're going to find out a little bit more about that in just a sec. Jessica and Saskia and Dr. Oliveira, thank you all so much for your wise words this evening. Jessica and Saskia, I know you're going to be on the Instagram live, which is going to be going live at 7:30 straight after this. Like I said, we'll be talking about student life after this short break, where we're going to show you tours of the two main buildings where KMMS students study and are based.
Hello everybody, my name's Joe, I'm a first year medical student.
Hi guys, my name is Garima, I'm a first year medical student at Kent and Medway Medical School.
And this is our wonderful pairs building. We spend about 50% of our time here, the rest of the time being split between our site at Canterbury Christchurch University, as well as being out on placements or just kind of chilling around at home or being at either of the libraries on either of the campuses as well. So this is one of our main social spaces in the pairs building. So you'll find a lot of students here before and after lectures, maybe getting some snacks from the vending machines, maybe from the coffee machine as well. It's a kind of a great space to kind of chill out after some very informative lectures.
After our lecture end, we have a reception here. If you have any questions regarding academics, your mental health, we also have a student life and well-being support here. We also have a therapy dog, her name is Olive.
Got some wonderful spaces to study in. I've spent many hours here, some late nights. Security comes around every now and again to make sure that everybody's safe and the building's being looked after. But it's a great environment to study in and to learn to become a doctor. So what makes this building different is the GP simulation suite. It's the first of its kind in the Kent area, and within that you can practice your kind of simulation trainings, your skills, your communication abilities, taking histories.
I think being in the GP room would really help me in my learning, especially during OSCEs, especially for communicating with patients, being exposed in that environment.
So this is one of our seminar rooms. We have 3 on this floor, and as you can see we have special partition walls which can open up. So in essence the 3 seminar rooms become one massive room, but also we can come in here as individuals ourselves or even in small groups to use them for our independent study time. One of the things I personally like to use the seminar rooms for is, particularly at the end of the day, I'll come in here usually by myself and I'll use the massive whiteboards here to write all of the lecture notes down, the notes I made, kind of understand it, process that information.
This is one of our PC rooms. We have few of our tutorials here. We also write our exams here. Some of us sit here and actually rewatch few of our lectures here. You can also have a place to study if you're more of a computer person.
Fun fact about some of our PC rooms is they have some standing desks. So particularly when you're studying for long periods of time, for at least me, I like to kind of sometimes get up, stand around and kind of work doing a bit that way. So you have that option here as well.
Hi, my name's Dave. I'm a first year student at KMMS. This is our first year. Very exciting to get into the new facilities here behind me and have a look at the new dissection rooms, the new cadaver rooms. It's going to be really exciting.
Not only is the building modern, but also having the opportunity to work with other healthcare professionals whilst we're studying is really exciting. It's something that I think will make us better doctors in the future. So here in the Anatomy Learning Centre, we're in the dry room. We'll do some of our learning with the models shown here, and then after that we will go into the dissection room.
So what I'm personally excited about is the opportunity to get to mix and work and collaborate with other students to start off with. The second thing is what we're learning in the lecture theories is the theory. It's really interesting, but in here we get to apply it to models, and then just next door in the dissection room we get to learn and apply it from real life cadavers, which for me is one of the main reasons why I came to KMMS.
It's really exciting to come here and to see all these different facilities that we have for our learning, and also to be able to know that we can also collaborate with other healthcare students in this building. So yeah, really excited about that.
So here we are upstairs, and I'm just going to go into the hospital simulation suite and have a little investigation myself.
So there's an 8-bed simulation suite that has models in there, and then there's a 4-bed simulation suite as well, where you can do a lot of things, measuring blood pressure, hearing the breathing rate of the simulation equipment, and also doing a lot of other things. What are you most excited to do, David?
I think I'm a bit overwhelmed just by how much there is, to be honest. One of the things I'm really interested in is one of the ICU rooms, so the intensive care unit rooms. When that gets set up, that'll be really interesting to see how it works in a simulation setting. So here we are in the simulation suite. This is the first time we've been in the room, and I'm a little bit blown away by just how real the models are. So this one I can hear as a shortness of breath, you can hear the wheezing. We can do loads of things, different things with the models as well. We can do blood pressure, we can feel pulse. It's really exciting. Creepy thing is they blink. But again, I suppose that's real life as well. So here we are in one of the lecture theatres. As you can see, it's very, very different to normal lecture theatre, and the idea behind this is to encourage us as medical students to collaborate with each other, which is what we'll hopefully do moving forward in healthcare.
Welcome back to the KMMS Virtual Open Day. To tell us a little bit more about student support, wellbeing and general life on campus, we've got Dr. Julia Hines, who is the lead for medical ethics, law, professionalism and medical humanities, and the academic lead for student life and wellbeing. We're also joined by Nazar, who's the MedSoc president and Year 2 KMMS student, who will tell you all about how you can get involved with student activities at KMMS. Now, don't forget to put any questions about student life and wellbeing, finance or accommodation in the live chats for Dr. Hines and Nazar to answer after their presentation, which shall begin shortly. Dr. Hines and Nazar, I'm going to hand over to you.
Hello and welcome to this section. It's a very important section on student life and well-being. You will have your course, but running alongside it, we're going to tell you about how we're going to look after you. So student life and well-being is what it states. It's all about your well-being, your physical well-being, your mental well-being, and also about your life-work balance. So you can pop into KMMS, Student Life and Wellbeing, if you just want to have a chat, if you have a query, for example, where is such and such a room, or where should I get my new student card? And we can also, if you have a deeper query or more serious about your well-being, we will signpost you to the relevant services. Now, we sit under two universities, which is Canterbury, Christchurch and the University of Kent. And all our specialist services are availed of at the University of Kent. So you will look to the University of Kent, for example, if you run into health difficulties and you need, you would like to avail of counselling or help with your mental health, or academic study or academic study skills. We also will pinpoint you towards housing and the disability services. For example, if you have a learning disability and you would like to draw up an inclusive learning plan. And on the other side of the wellbeing service are the activities and other supporting events. And we have lots of those planned. As I say, we're under both universities, so not only can you avail of the wellbeing events at KMMS, but you can also avail of all activities at the two universities. And very importantly, I would like to introduce one of our key members of staff at Student Life and Wellbeing. She has 4 legs and 2 very lovely velvet ears. Her name is Olive and she is our therapy dog. So I think we're one of few medical schools. You can tell me if you have heard of any other medical schools with a therapy dog with paws running around. And Olive has been very popular with our students, so much so that she had to on book some of her appointments, and we're looking to bring in perhaps more therapy dogs. So the students would, if they have a stressful day or they would just like to check in with Olive, they can have some Olive time. And you can see that she has a little name tag herself. She has attended a few lectures. She does paddle around campus and always supervised, of course, in case she steals some sausage rolls. But there we are. I'd like to introduce you to Olive. So next slide, please. So we also have to get you into the swing of medical school. We have a welcome week each year. And the welcome week would have various activities, and it does what it says. There are lots of activities, lots of fairs going on, lots of desks and lots of information. And it's there to give you a very warm welcome in first year. And we also have a welcome back week then for your subsequent years at KMMS. So we always are there to open our arms and welcome you. And we also have KMMS activities. We have the 2 student unions. We have MedSoc, and Nazir will tell us lots more about MedSoc. We have a peer mentoring service. We also have keeping fit and sport. You can go and join the gym on campus. And we have offer holders Facebook and newsletters to keep you up to date with all that's going on at KMMS. Next slide, please. And what about accommodation? I can see that there's a few questions that came in earlier with regards to accommodation. So as pointed out earlier, we are under the umbrella of 2 universities, Canterbury Christchurch and University of Kent. And so you can choose where you would like to go. Either University of Kent will be on the nature reserve. There are lots of trees and rabbits running around and lots of wildlife. You'll see many people walking their dogs. There's a stream, and if you like nature, you'll like it there. There is also the option of going to Canterbury Christchurch accommodation, and that will be in the city. So Canterbury is a historic city, and there are lots of little cobbled streets and curious little shops and bookshops and restaurants. So it depends what type of lifestyle you would like to have. As Dr. Oliveira mentioned earlier, we will have lectures on both campuses, and so we always hope to divide them equally. So it will be a stroll if you're on Canterbury Christchurch to your lectures one day, or you may take a bus then to the University of Kent or drive if you are on CCCU Canterbury Christchurch accommodation. Next slide, please. So what about finance? This is a major question. Undergraduates will be able to avail of Student Finance England, and that will cover your tuition fees and your maintenance, so you can take up to 4 years of those. There will be also an NHS bursary to cover 5th year. And if you get into difficulty, there is also financial support. For example, we have hardship funds, but other financial support in general would be the KMMS financial support package, and students can receive up to £1,500 pounds per year for up to a maximum of 6 years. There's also a Care Leavers bursary, access to the Learning Fund, and also partner school scholarships. And if you have an inclusive learning plan, if you have a particular learning disability, then you can, or a mental health condition or a physical health condition, you can avail of the Disabled Students Alliance, and that will be through Disability Services. We also have the Volkswagen Foundation Fellowship, and that's financial support for recent PhD science graduates with research experience. And we also have a number of scholarships. We have a very high number of scholarships. If we go to the next slide, please. In 2020, a quarter of our students availed of scholarships, and so we have successfully fundraised for scholarships for the 3 years so far, and our ambition is to continue to do so for future years. And every year, home students may be eligible for the partner school scholarship, and all this information is available on our website. We also have music and sports scholarships, and in the picture here you can see one of our musicians, and more information is available on the website at the address mentioned just on the slide. Next slide, please. So without further ado, I will introduce you to Nazir Carey, and Nazir is our president of MedSoc. Over to you, Nazir.
Hello, everyone. I am Nazir Carey. I'm the president of the Medical School Society. As you can see behind me right now, I'm in Christchurch, one of the Christchurch's libraries. It's called Augustine, and if you're a future KMS student here, you will likely be studying here and spending some of your time here revising for your exams. So, as you know, KMS is a joint school between the University of Kent and Canterbury Christchurch. So this means we reap double the benefits. You'll be members of both student unions, so you're able to join over 200 societies across both campuses. As members, you also have the power to vote and run for both unions. Next slide, please. Now, moving on to KMS's Medical Society. Currently, every single medical student in KMS is part of MedSoc, we're a student-run body with many roles. For example, there are academic representatives who feed back your opinions to the school. Now, each year has its own academic representatives. So next year, you'll have the opportunity to run for first year academic representation yourself. Next slide, please. Moving on to the social side, one of the key events students look forward to is the annual MedSoc Ball. Our most recent one attracted over 200 students and staff, where we all dressed fancy and had some fun, as you can see in the photo in the top right. There was also a charity week, which raised a substantial amount of money, and one of the highlights was a staff versus student sports day, where there are events like tug of war and dodgeball. I'm sure the staff know that there are some unsettled scores, as you can see in the photo below. Also, within MedSoc, there are plenty of sub-societies. As you can see, some listed below. One, for example, is a sports sub-society. They've organised tournaments in for many different sports. A big upcoming event is a competition between our rivals, Brighton and Sussex Medical School, next month. During our time there, we'll also have some time to socialise with the students there, and we'll be going to the beach. As KMS is a growing school, you'll have the opportunity to be you could have the opportunity to be the founder of your own sub-society, and something that you may find interesting if it's not already been created. Now, unfortunately, I don't have all the time to tell you about all the other roles and all the other events that we've been doing this year and even next year, but this is only a quick taste of what's to come when you become a KMS medical student.
Thank you, Nazir and Dr. Hines. That was great insight into the support on offer to help students succeed and have fun. And of course, best of luck against Brighton and Sussex Medical School in the varsity game. We've got time for a couple of questions for both of you. We're going to start with you, Dr. Hines. We've had a question asking, what kind of support sessions are available for students?
Well, we have for different areas of your well-being, we have different support sessions. So, for example, we have mental health support sessions, first aid, mental health workshops. We also have study skills. You can feel of study skill sessions, and they would be within the other universities. Or you could have support, for example, on a one-to-one. And that would be academic, for example. You have a personal academic tutor. Every student is allocated a personal academic tutor at the outset of their medical degree. And the academic tutor would help you through any academic difficulties you have. But if you happen upon a health difficulty, then your tutor could signpost you to the Student Life and Wellbeing Service. So we have many different areas that we will care for. I mean, we're made up of many different facets as human beings, and our aim is to encourage you to develop your own personality. But as humans, we all perhaps, can in our lifetime get sick, and we will be there to support you if that unfortunately happens to you, or if you indeed suffer from a chronic healthcare condition, we will support you through that at your time at KMMS also.
Yeah, it's really reassuring for those prospective students. What about those prospective students who might have specific additional learning needs? What sort of support is on offer from KMMS?
Okay, so if you would like to disclose if you have an additional learning need, then you can do so and draw up what's called an inclusive learning plan with the Disability Services at Kent. And within that inclusive learning plan, there could be a number of what we call reasonable adjustments. And so this is very important that this is tailored to what is entitled the Equality Act 2010, and also in line with GMC guidelines and the university guidelines. And it can include things such as extra time in exams, perhaps you have dyslexia or another learning disability, and you could avail of extensions in your essay. You could have a mentor. You could avail of Disabled Students Alliance. So it really depends on the actual extra learning need that you have, or the mental or physical condition, mental health condition or physical health condition that you have. But your inclusive learning plan will be tailored for your individual needs.
And NASA, let's come to you for some more student lifey kind of questions. Are med students normally involved in societies at both universities, or is it just MedSoc activities that KMMS students tend to be involved in?
So, being a Kent and Medway Medical School, being a medical student at KMMS, where we can be part of Kent, we can also be part of Christchurch, their societies, and we also are part of MedSoc. So we have unlimited range of what we want to be or what we can be. For example, I'm part of Canterbury Homeless Outreach Program, and I go out and help the homeless. There's other like religious societies, there's other sports societies, and you can choose whether you want to be part of the ones in Christchurch or the ones up at University of Kent. So there are a plethora of what you want to do, to be honest.
Yeah, that kind of touches on a question that we've got in from Annika. She's asked, what are the societies that we can be part of, and do the societies at KMMS actively organise events that allow students to network? And from what you said, that's obviously there. Maybe give us a bit of an idea of some of the diversity of the activities. Are there some really wacky ones that you can get involved in? What are some of the more standard activities that students can get involved in?
So with MedSoc itself, for our freshers, we had a pie contest, I think, and if you paid a certain amount of money, you could get involved in throwing some pies at staff just for a laugh. There's also there's many societies. I can't think of any off the top of my head. I know there's like chess as a Kent society, and there's also a Greek society and a lot of ethnic societies. There's just so much, to be honest. And if you can't find something that you're interested in, you could probably do it yourself. You could probably be the founder or the one to start it up. Who's going to stop you?
Absolutely. I think that's a really great message for those prospective students to take away, that there is basically anything that you want to do. It's either there or you have the tools to be able to start it. Dr. Hines, we're going to come back to you. We've got a question. Do students have academic tutors?
Yes, we have what's called a PAT. So it stands for Personal Academic Tutor. And you will have the tutor in various forms throughout your medical degree. and from the very first week you'll be introduced to your tutor, and you will be it would be necessary to have a number of mandatory meetings with your tutor each year. One each semester is the baseline, but there's no upper limit. So if you need extra meetings were available, then your personal academic tutor would be very happy to meet. And this is a mixture of, mostly it's academic care, but it can touch on pastoral and well-being. But your personal academic tutor wouldn't be there to assist you with, for example, illness. What they would do is signpost you to professional services, to qualified professionals in the area that you need help in, and they would help you.
Thank you, Dr. Hines. A final word from you, Nazar. Saskia's asked, another question for Saskia, saying, with accommodation, will KMMS students be integrated into flats with students from Canterbury and Kent?
With the current system, with our year, my second year and the first years, KMMS students were put together. If you chose, for example, Pinhill, you're put with Pinhill medical students that also chose Pinhill. If you chose Petros, you also got put with medical students that also chose Petros. Just so it's easier. You'll have the same exact deadlines and same exact exam dates to all to prepare for, all to revise for, and so it doesn't really cause a ruckus.
Absolutely. Dr. Hines and Nazar, thank you both very, very much. We're going to take a short break and then we're going to be back for the final part of our event. Some more admissions based questions and any other questions that are that you've got, any burning questions about KMMS and about the experience or about the course. Now's your time to send them in because we'll be getting them answered in just a few moments' time.
My favourite thing about Canterbury is how it's so diverse in terms of you've got the countryside right on your doorstep and then you've got the city right on your doorstep as well, which is really nice.
I really like the people in the area. It's quite a diverse set of characters and there's quite a lot of green too, especially now in summer.
It sort of feels homely to me, like it's so calming and sort of accessible. You can so easily get into town from the uni. There's so many things to do.
I think it has a great balance between sort of the calm, relaxing aspect, so you get to live in a place where there's loads of nature and you can just walk around and feel really relaxed and take a break from studying. But at the same time, there's some really great places to sort of go hang out with your friends on a Friday night and enjoy yourself.
What I like about Canterbury is how lively it is and all of the parks that you get to walk into and the shops, and it's a great walking town, essentially. And it's great when the weather is nice and the sun comes out. The people also come out, and I love that.
We get our Wednesday afternoons off on our timetable. And I normally use that to play some sort of sport, or if I've finished my work, I normally go socialise with other housemates.
I recently joined Netball Society, so I've been going to that every week. It's a really good way just to get out the stress and relax. I also play a bit of piano.
I have really good housemates and I found a really good group of friends, so we go out into town a lot. There's tons of great parks to sit in, there's cafes and libraries to go to, and there's a lot of really nice places that are just sort of a really short drive away. So you can go to the beach, you can get the train to London for the weekend if you want. Yeah, there's loads of things to do.
I chose KMMS because it was an integrated program and we get to learn from placement from the get-go. So from first year and second year we're in GP placements, and then from third year onwards we're in hospital. And that's something that really interested me because I like putting things into practice, and I thought that being able to go on placement and see the practice of what we're learning would really help my understanding.
I was amazed with their vision and their goals for the school. So as a new school, they were really keen on integrating the course so that we start placement from very early on and get that early patient exposure.
When I attended the MMIs, I felt really welcome and I felt like I was wanted and was going to be part of something great.
The reason I chose KMMS was because it was a new medical school and that really appealed to me. I found that really exciting.
I chose KMMS because they're very patient-centered in their teaching, and I want to be a good doctor in the future, taking care of my patients.
Dr. Anna Oliveira has rejoined us, who's going to be helping to answer those questions that you're sending in just a few moments' time. But first, we're going to go to Dr. Philip Chan, who's the lead for admissions. He's got a short presentation for you. So, Dr. Chan, it's over to you.
Lead for admissions, as Mark says, and I'd like to welcome you to our virtual open day. So, first slide, please. Right. Okay, next slide, please. That is me. I just want really to show you the admissions situation from my perspective. Right? The admissions situation is like this. The medicine is really exam heavy, right? And therefore, we tend to select people with really good exam results. And that seems extremely sensible. However, the way that things are in this country, right, there is a social divide with exam results, because the best exam results are focused in the best schools, which essentially are selective state schools and private schools. The effect of that is it reinforces inequalities in society. And you can see on the slide some of the salient facts, such as 20% of schools in the UK provide 80% of all graduates, that the 7% of the UK population educated in independent schools make up 22% of medical and dental undergraduates, and 50% of people like me who are medical faculty. Half of all schools in the UK do not even send one student to UCAS to apply for medicine. That graph shows, in orange, students from the most privileged 20% of the UK, and in blue, students from the least privileged 20%. What you see is that medicine is the most socially exclusive of all the professions, more than law, more than engineering and tech, and actually a lot more than the normal distribution of those groups in university education. What that means is that many young people have diminished life chances, right, in terms of applying for medicine. Next slide, please. Next slide, please. So all the new medical schools are charged with widening participation in medicine and doing something about this problem. And the way that KMMS approaches it is like this, right? That we do have pretty strict minimum criteria, which are published on our website, on our prospectus, and they relate to GCSE grades if you're pre-A level, they relate to A-level grades if you're post-A level, and we also use the UCAS admission test. We do not use predicted grades at all. The reason is because they're about 50% wrong, so they're no better than guessing. And privileged young people who are well behaved tend to be over predicted, and less privileged young people who may not be so conformist are under predicted. So they're wrong, and they're wrong in the wrong way. We use a standard conditional offer of AAB. That is the lowest conditional offer in the country, and it matches the so-called contextual offer of many other medical schools. We do not give a discount on AAB. We do not make a lower offer, except occasionally to students from our partner schools here in Kent. We have only ever done this less than 5 times in our existence. We, however, do enhance our contextual approach. And the typical KMMS accepted entrant has achieved strong results in maybe not the best schools. Next slide, please. Let me illustrate that further. let us pretend that it only takes one exam to enter medical school, and that exam is scored out of 100. And the medical schools have got together and said that you need a score of 70 to get in. But because it's quite competitive, the average score of medical school entrance is actually 75. I'm going to give you two young people. One of them has had a pretty tough life and goes to a terrible school where the maths teacher is trying to teach A-level biology, and they haven't had a chemistry teacher in 10 years. And therefore, when they send students for this exam, this fictional entrance exam, their average on that is 50. And this candidate has actually achieved a score of 70 and does meet the minimum requirements for entering medical school. And then I'm going to introduce to you person B, who goes to the type of school that we would all like to go to and we would all like to send our children to. Which is absolutely fantastic, has an unblemished record of sending students to the most competitive courses in the most competitive universities. They always have medics every year, and their average on this test is actually 80. And this candidate has achieved a score of 75, which is not really normal for the school. It's a bit below what his school average is, but it matches what the normal medical school entrant gets. And actually, his school, B score is higher than A's score. Now, you only have one place to give to interview, so I'm going to ask the audience at this stage to vote in the chat. You've got that one place. Are you going to give it to student A, or are you going to give that place to student B? And Mark will keep an eye on that and tell me how the A's and B's are stacking up while we gently and slowly move to the next slide. Next slide, please. So, how are we doing, Mark? Okay, just give that a moment. We will then, what we will then do is to group people into different groups which have got slightly different requirements. There's a pre-A-level group, there's a post-A-level group who are on gap years. We also have a postgraduate group because we do not accept any predicted grades. If you're in the final year of university, we don't accept the predicted grade for your degree. We will actually consider you on your senior achieved grade, which is your A-levels. And of course, there are always going to be some people who have got special situations and which we can't actually use a contextualization approach. But what we will do is that we will do something like in the previous slide. If you voted for A, we will do what you want. If you voted for B, every other medical school does that, except KMMS. I hope that's made it absolutely crystal clear what contextualizing in KMMS terms means. The results for that is that we never ask you questions like what postcode you live in, what your parents do for a living, whether you're in receipt of free school meals, whether you're in receipt of a 1690 bursary, whether you're in receipt of a UCAS bursary. We don't ask you any of those things at all, ever. Nevertheless, we have a widening participation-friendly shortlist. And using various criteria, such as the Kent criteria, 42% of our entry class are from widening participation backgrounds, and the Kent criteria covers 42% of households in the UK. So coincidentally, we have a representative class. The national average, 22%. Using this database, which is of progression into further education, 13% of our entry class are from the lowest 20%. That is those orange the blue figures in the previous graph that I showed you. The national average is 5.5%. Next slide, please. So the way that we run the process is that you have to pass through several stages. And at each stage, when you pass, you are all equal again. So we never carry over whether you easily passed or you had a high score or whatever. You're all equal at the next stage. And so as you see, you have to go through 3 stages to get as far as an interview. Those are all academic stages. And the third stage, interview, is a non-academic stage. So you need to have the minimum requirements according to what group you're in. You need to pass our UCAT threshold, which is actually a pretty generous threshold, right? It hasn't changed for 2 years. It's the 45th centile. So you have to do as well as 45% of the top 65% of the students taking UCAT. Sorry, I think I got that wrong. No, the top 55% of the students taking UCAT. At stage 2B, we then compare your academic results. If you're pre-A level, that'll be your GCSEs, against your school average. And we will do that individually for every applicant. And my spreadsheets are enormous. And then we will pick the top however many people we can interview, and we will then interview them. We only interviewed 430 out of 1,713 applicants. It is not easy to get into KMMS. So if you have joined us because you think we're a new medical school and we're going to not have many applicants and we're an easy option, actually we have one of the highest applicant ratios in the country. The MMI is 7 stations. The details are on the website and also on YouTube. You can actually see me talking about it. They are in person this year for all home fee status applicants, remote for overseas, and they are very, very, very different to other medical schools' procedures because we are charged with doing things differently. So what we don't do is to ask you a set of stereotypical questions that you can find in really on 5 minutes look on YouTube or on the internet. We won't do that. We won't reward you for rehearsal or preparation. Right? And actually, a lot of our students have said, and I hope they'll back me up on this, that preparation is actually a disadvantage when you come to KMMS MMIs. And that's because we want to see you as you really are, rather than as the person you want to present us to please us, because we don't care about that. Next slide, please. So we are really looking for the best doctors, but we are also committed to looking at students who may not be looked at by other medical schools. We do want you to be academic excellent relative to your educational background. We want you to be resilient. We want you to be committed to these kinds of values, which are the values of the NHS. Really, we just want you to be fantastic human beings. We are more interested in people who walk the walk than people who talk the talk. Next slide, please. So I'd be very happy at this stage, once I've rumbled through that, to take questions. I know there are always millions of questions at this stage, and I'll apologise in advance to Dr. Oliveira because a lot of the questions are to do with admissions requirements. So yeah, over to you, Mark.
Yeah, spot on, Dr. Chan. We always have an absolute stream of questions relating to admissions. Just to begin with by saying, in relation to your earlier question about student A or student B, it was unanimous for those viewers voting for A, which was obviously really interesting. We've had a question in for you, Dr. Chan, who's asked, do you have any advice about taking the UCAT and how can you prepare for it?
Yeah, the UCAT is a test that you need to prepare for but not revise for. It is not a knowledge test, unlike the BMAT, which we don't use. And it doesn't test you for scientific knowledge. It doesn't test you for your skills in expressing yourself through the medium of essay writing. It's more like an IQ test. Now, UCAT offers its own sample paper, and quite cheaply, you can buy a lot of UCAT preparation questions in book form from a lot of different vendors. It's something which you need to prepare for because it's a timed exam. And most of the questions are not that hard, but they're hard to do in the time available. So what you need to do is to develop a skill of actually sitting this particular exam and allocating the right amount of time to maximize your scores.
Thank you very much, Dr. Chan. Dr. Oliveira, we're going to bring you back in now. We've got a question that is asked, what kind of teaching happens in the simulation suite?
Thank you. Thank you for the question. Interesting one, especially if you've never been in the simulation suite, which is an amazing facility. And I hope one day you have the experience of being there. We can have plenty of different teaching, but at the moment, especially in year 1 and year 2, is designed for you to have all your clinical procedures, the teaching, and all the examination teaching. So it's in the simulation suite that when you're going to learn about blood pressure, venipuncture, respiratory examination, cardiovascular examination, peripheral vascular examination, that's the space that is dedicated to do that. And later on can also be used to simulate situations of acute illness, for instance, where you will be trained in a very safe environment, protected environment with simulated situations to act on that acute situations, which is way more protected if you have a real patient with you. So it's exactly when we say a simulation facility, exactly that. It helps you simulate certain procedures, so you learn, you are able to practice, and then you can do it supervised in real life.
And how vital is that, Dr. Oliveira, for students who might not have any medical training up till this point to really get kind of hands-on and get that sort of experience that they might experience on a ward or in a clinic? How vital is that experience?
I would say extremely vital. Initially, when they start medical school and 18 or graduate, in the first year, it's vital because it's there where you're learning your first skills. And some procedures, one that I mentioned, venipuncture, is one of those that we ask, and it's compulsory that you do it first in a simulated environment, safe, protected, supervised, before you even try it. And for instance, you can then do it once you learn on campus, you can then do it during placements. So it is vital and demands zero previous knowledge from the students besides the knowledge they get in on-campus learning and in the lectures, etc., before they go to the simulation suite and learn about how to do blood pressure, how to do peripheral vascular examination, etc. In later years, in situations like I was mentioning, for instance, on acute illness, it is extremely important because it allows for a protected environment. It allows for mistakes that you don't want it to happen later on. It allows for the student to practice, to learn. And even since year 1, we allowed students to book the simulation suite and go there as a group, do peer learning between them, book what equipment they need, and practice their skills and learn more and more. So it is extremely vital.
Thank you very much, Dr. Oliveira. A question from Lydia for Dr. Chan now. Can you talk a little bit more about the significant health inequalities in Kent and Medway? What are the problems that KMMS are hoping to pinpoint and solve? She said maybe kind of looking at 3 priority areas.
I came here from South Yorkshire, and actually I was pretty amazed at the health situation here in Kent. Because in many ways it's actually more deprived than some of the areas that the post-industrial areas up north that you feel are deprived. So, for example, in terms of the index of multiple deprivation, North Kent and coastal Kent contain some of the top 10 most deprived county postcodes in the UK, which is amazing news to me. Kent also has one of the lowest number of doctors per head of population in the UK, much lower than South Yorkshire and way, way lower than London. Kent also is losing doctors in certain specialties, and so they actually have negative growth in the number of doctors in general practice and in mental health, whereas the rest of the country has, on average, positive growth, even though not as high growth as in more popular areas. We see ourselves at KMMS as the tide that floats all boats. We see ourselves as being an attraction for doctors to come, study, stay, and work in Kent. We are attracting talented doctors from outside Kent in order to come and work with us. And we feel that the more work we do, the longer we are established, that we are the tide that rises, and that the health situation, the health landscape will improve just by the fact that we are here and doing our work.
So for those of you prospective students watching, Kent, really a patch where you can do a lot of good in. Dr. Oliveira, a question for you. For clinical placements throughout the 5 years, are they always in a block of 1 week, and are they always based in Kent and Medway, or do they look further afield?
Just to highlight, the clinical placements throughout 5 years, they differ between the first 2 years and then year 3, 4, and 5. So the first 3 years at the moment been with isolated weeks. So they last for an entire week, but they happen twice per term, more or less in average. And that's been the primary care placements, and that's until now. From third year, that's when secondary care placements start happening, and they're longitudinal placements. So actually, most of the year, the students are off campus. So it's not only a week. The students are really off campus. And yes, they are in the Kent and Medway area. I hope this answered the question, but happy if the person that asked if they want any other follow-up, I'm very happy to explain.
Brilliant, and we've obviously got the Instagram live that's going on straight after this at 7:30. So if there are any questions that don't get answered now, that is the place to ask them in. Dr. Chan, coming back to you, a question that we've got from quite a lot of viewers this evening. Would you say it's going to be more difficult to be offered a place at KMMS if I don't take chemistry for A-level?
No, we don't operate any kind of informal preference like that. I mean, what our requirements are exactly as they put, right? So you need 2 science A levels, one of which has got to be either chemistry or biology, and the second one can be the other one, or it can also be maths, physics, psychology, or computer science. The third A level can be anything except general studies and critical thinking. And we have similar regulations for the IB diploma for higher level subjects. And it is exactly as it's written. We have no informal preference.
Hong Tu Lee sent in a question. Is there an advantage in entry assessment for a PhD degree holder?
No, there is no advantage for that. A PhD degree holder would obviously be treated as a postgraduate. We would actually look at their first degree, at their bachelor's degree. We do not operate any advantage for second and third degree level degrees after that.
And coming back to the UCAT, which we spoke about.
I should say we have a number of our students do actually have PhDs.
Yeah, and we were obviously hearing from Jessica a few moments ago about being a mature student, and so there is, the net has been cast really wide for students of all backgrounds to come to KMMS. Now, you spoke a little bit a few minutes ago about UCAT, and Mia's asked, as you answered, Philip, having a high UCAT score and good GCSEs, what role that plays in the offer. But also interestingly, she's asked, do you give out unconditional offers, and if so, how do you go about getting those?
You can have an unconditional. We do give out unconditional offers, but for people who have already fulfilled our requirements. Right? So, for example, if you're on your gap year, you've already taken A levels, you've already achieved AAB, and you've got through the rest of the selection process, you'll get an unconditional offer. If you're a postgraduate and you've already achieved the correct level in your first degree, and whether or not you're sitting a second degree, you will probably get an unconditional offer. So, yeah, it's not uncommon. But of course, if you're pre-A level, you will not get an unconditional offer.
We've had 3 questions in from Annika, so we'll race through those as we're coming to the end of this event. She said, as it's a new university, is the accreditation the same as other medical universities?
It is absolutely the same as other new medical universities, in that full accreditation is only granted when you graduate your first group of students. But the General Medical Council is trying to support you every year towards that aim. So essentially, when our first group graduates in 2025, so does KMMS.
Now, I must apologise. We've had the same thing that we had with the Saskias earlier on. We've got multiple Annikas who sent in questions. So from another Annika, she's asked, as it's a new university, would you say there's more modern approaches to teaching and to the degree?
Yeah, go ahead. Hi. I think we have an opportunity here to be more innovative, yes, and to respond to what is out there, what we know, what works best, and to respond quite quickly, actually, to what is working to our students. I think something that actually was Jessica that said, one of our year one students, about we working with them and responding to what is working with them, and that we try some things. That includes learning methods. Yes, we try to be innovative. We try to see what works and what doesn't work. And if it doesn't work, we'll work with our students on that. But being a new medical school gives us that opportunity within the mapping and the outcomes we have from the GMC and Brighton and Sussex, of course. But we have that opportunity to innovate in how we teach.
Now, like I said, we're running very short on time. We've had a question in from Tamsin and Lottie. They said, will there be a disadvantage with no clinical work experience to getting on the course? Dr. Chan, we'll come back to you for that one.
We don't formally assess work experience as part of the selection process. However, we do recommend work experience. And if it's not in the health sector, then we recommend it to be at least customer facing, so that it's not a surprise to you when you actually have to meet patients. So we definitely think that work experience is a good thing, but we don't assign a mark to it. I guess that's the way. We're also very mindful of the fact that COVID has completely disrupted work experience for really 2 or 3 years of students now.
That's fantastic. Dr. Chan and Dr. Oliveira, thank you so much for your time. That's it. My thanks to all of our other panellists for taking part today. But most of all, thanks to you at home for sending in all your questions. Hopefully we've been able to answer most of them. If this has whetted your appetite to find out more about KMMS, we'd love to meet you at our upcoming in-person open day on May the 14th. Visit the link on the screen to book your place now. The admissions team, as I said a few times, are live on Instagram every Wednesday at 12 to 2, but today is very special. They'll be live in just a few moments' time, doing a special live session for the next half hour to answer all of your follow-up questions. If you have any more questions, head over to Instagram now at KMMS Med School. But that's all from me. Thanks so much for watching the Kent and Medway Medical School Virtual Open Day, and we hope to see you soon in the very near future. Goodbye.